A variety of illnesses that affect your heart are referred to as heart disease. The following are the examples of heart diseases. Coronary artery disease. It is a type of blood vessel disease. Problems with heart rhythm, known as arrhythmias. Birth defect known as congenital heart defects. Valve diseases, muscle disease. Many types of heart diseases can be avoided or cured by adopting a healthy lifestyle. Symptoms of heart diseases vary, depending on the type of heart disease. Atherosclerosis, or the accumulation of fatty plaques in the arteries, can harm blood vessels and the heart. Buildup of plaque causes blood vessels to narrow or obstruct, which can result in heart attack, chest discomfort, or stroke. Coronary artery disease symptoms could be different based on genders. For example, male has a high chance to have chest pain, and women are more likely to get other clinical symptoms, together with chest pains, including breathlessness, nausea, and extreme tiredness. Signs and symptoms of coronary artery disease include chest pain, chest tightness, chest pressure and chest discomfort, shortness of breath, pain in the neck, jaw, throat, upper abdomen or back. Radiating pain from center of chest to left hand little finger is classical symptom of heart attack. Coronary artery disease may not be discovered till a heart attack, angina, stroke, or other heart problems noticed. Regular assessments can possibly detect cardiovascular problems at an early stage of disease. Symptoms of heart disease, related to irregular heartbeats, are known as arrhythmias. The major causes of arrhythmia include coronary artery disease, diabetes, drug abuse, excessive use of alcohol or caffeine, congenital heart defects, high blood pressure, smoking, some over-the-counter medications, prescription medications, dietary supplements and herbal remedies, and valvular heart disease. These patients may feel heart is beating too fast, too slow or irregular. Typical arrhythmia signs and symptoms includes fluttering on chest, fast heartbeat known as tachycardia, slow heartbeat known as bradycardia, chest pain or discomfort, shortness of breath, vomiting, dizziness, fainting or near fainting, blackout. Treatment for life-threatening arrhythmia needs immediate medical intervention in form of shock medicine. Other treatment options includes radiofrequency ablation, pacemaker, ICD, CRT. Next, we are going to discuss symptoms of heart disease, which is related to birth defects, also known as congenital heart disease. Major heart defects that baby born with are usually noticed shortly after delivery. Here are a few listed: tricuspid atresia, tetralogy of Fallot, truncus arteriosus, transposition of great arteries, etc. Congenital heart defect. Signs and symptoms in children may include blue skin color, known as cyanosis, swelling of the legs, abdomen, or eyelids. During feeding, mother may experience shortness of breath on baby, poor weight gain. Congenital cardiac abnormalities that are less significant are frequently not discovered until later in childhood or adulthood. Here are a few listed: ASD, PDA, VSD, etc. These congenital heart disease are usually not immediate life-threatening, and its symptoms and signs include quickly getting breathless during exercise or activity, easily exhausted through physical activity or exercise, hands, ankles, and feet swelling. Symptoms of heart disease related to heart muscle is named as cardiomyopathy. Cardiomyopathy is a cardiac muscle disorder that makes it difficult for the heart to pump blood throughout the body. Heart failure can result from cardiomyopathy. Dilated, hypertrophic, and restricted cardiomyopathy are the three primary forms of cardiomyopathies. Patients with this condition may have symptoms of breathlessness with exercise or at rest. Legs, ankles, and feet are swollen. Fatigue. Heartbeats that are irregular, hammering, or fluttering, dizziness, and fainting. During a heartbeat, healthy heart valve leaflets can fully open and close the valve, whereas diseased valves may not be able to do so. Any heart valve can deteriorate, but the aortic valve is the most usually affected. Diseased valves can become leaky so they do not fully close. This is named as regurgitation. If this occurs, blood leaks back into the chamber that it originated from, and not enough blood can be pumped forward through the heart. The other major type of heart valve disease is stenosis, which occurs when the opening of the valve is restricted and rigid, which preventing the valve from fully opening while blood is trying to pass through. Causes of valve diseases. The major cause of these valve diseases are rheumatic fever, infections, due to infectious endocarditis, Connective tissue disorders. The signs and symptoms of valve diseases include fatigue, shortness of breath, irregular heartbeat, swollen feet or ankles, chest pain, fainting or syncope. Risk factors for heart diseases include smoking. Smokers have a higher risk of heart attacks than non-smokers. Poor diet. A high fat, high salt, high sugar, and high cholesterol diet can all contribute to the development of heart disease. High blood pressure. High blood pressure that is uncontrolled can cause your arteries to stiffen and thicken, narrowing the veins through which blood flows. High cholesterol levels. Plaque development and atherosclerosis are both increased by high cholesterol levels in the blood. Diabetes. Diabetes raises the chances of developing heart disease. Obesity. Other heart disease risk factors are often worsened by excess weight. Physical inactivity. Lack of exercise is linked to many types of heart disease, as well as some of the disease's other lifestyle factors. Poor dental health. Germs can enter bloodstream and go to your heart, producing endocarditis, if your teeth and gums aren't healthy. Heart disease can be prevented by quit smoking. Control other medical conditions, including hypertension, high cholesterol, and diabetes. Exercise for at least 30 minutes. Consume a low salt, low saturated fat diet. Maintain a healthy body mass index. Start reducing and deal with stress. Maintain a healthy level of hygiene. Thanks for watching. For more health tips and awareness informations, please subscribe to our channel and share this video with your friends and relatives.